How can two healthy parents have a sick child? Some genetic diseases are recessive, which means that two copies of the mutated gene must be present in order for the disease to develop. Cystic fibrosis is an inherited genetic mutation that causes thick mucus to fill up the lungs and digestive system. This makes the person more susceptible to bacterial or fungal infections, along with other symptoms including cough, difficulty breathing, inability to gain weight, and fatty stool. How can we predict the likelihood of a child inheriting cystic fibrosis? For the child to inherit this defective gene, they must inherit one copy of the genetic mutation from each parent. This means that if both parents are carriers, there's a 25% risk that the child will be affected by cystic fibrosis. For this reason, cystic fibrosis is considered rare, with only approximately 200,000 cases found each year in the U.S. You can think of cystic fibrosis like a boat with holes in the bottom, filling up with water. In the same way, patients with CF have tubes and ducts within their bodies that are filled up with mucus. CF patients need to routinely clear out this mucus to survive, just as the boat would need the water constantly bailed out to prevent it from sinking. How can we slow down the water? Treating cystic fibrosis is not as easy as just clearing out the mucus. There is no permanent solution, but there are a few treatments that can ease the symptoms and reduce risk of infection. They may use medication, such as antibiotics or mucus thinners, postural drainage to promote certain positions that make mucus drainage easier, chest wall oscillation, and in some cases, a lung transplantation. Currently, the CF Foundation is in the process of finding treatment options through clinical trials and research. Thank you.